No, no. Still laying underneath.
We will be done by 3 o'clock, right?
Are you talking about a different meeting?
Well, I don't know, the break's from.
Seeing that it's 10 o'clock, policy and governance. Notice meeting was properly posted October 15th. And discussion and possible action regarding the minutes of September 15th and October 6th.
Motion to accept minutes.
Second.
I have a motion and second. All those in favor say aye.
Aye.
Aye. Thank you. Departmental items. Discussion possible action. Benefits and retirement. Welcome to the day.
Good morning. I'll make this quick and sweet. Just wanted to give you a couple updates since we haven't had it on here for a while. The first one is the defined contribution plan. We're still working on the transition for that. We expect draft contracts to be ready this week. So hopefully by next month we'll have those in place and move forward. And annual enrollments next month, just remind you of that. We're going to do it the same way we did last year, distribute all the forms, make a contact sheet available to everyone if they have any questions or want to make any changes. And then the last thing, there's an agreement on the budget board Thursday for Lucid Lane. It's just a simple provider agreement. They do telehealth for chronic pain, substance abuse management. We have a lot of cases of people having surgery, and they really manage that transition.
Sorry, John.
Oh, you're fine. For those substances they're taking from their surgeries. So we really don't have that in place now. Very important because they transition the patient off of the substances and also help with pain management. So just a simple agreement. It'll be on the agenda on Thursday.
Increased cost or what's?
No, it really actually saves costs in the end. They did several studies, one through MD Anderson with all their patients going through cancer treatment, cancer pain, surgeries. Also Stanford, they did a big research study at Stanford for really the after surgery recovery and getting those people off those pain scripts and managing their care. Because there's really not too many plans in place to do that nationwide. So they're really a niche organization, and they have really proven results for MD Anderson and Stanford. So typically in a lifetime of a patient that goes through chronic care and chronic pain, if they're left untreated and not connected with this service, they usually cost about $15,000 to $20,000 more over the lifespan of their treatment for that condition. So this reduces overall treatment costs, and also really positively impacts the member. They really, they have less pain and less need for chronic substances.
Okay.
And that's all I have unless there are any questions.
Thank you, John.
Thank you.
Motion to receive.
Second, we don't need to recommend the agreement, do we? He didn't ask us to, so.
I think it was just for informational purposes.
Sounds good.
I have a motion and a second. All those in favor say aye.
Aye.
Aye. Bear with me, I get my glasses back on. Discussion possible action with the consultant management services proposals. Chantel?
I believe this item is just in response to any action that may be after discussion on item 5, so I would think we would probably need to do item 5 first.
Well, then
I can wait.
We'll move down to item 5.
Item 5 is just general wording to discuss the bid process regarding selection and evaluation for the proposals that we received. We did receive 7 proposals. We discussed that at the Special Policy and Governance Committee meeting previously. You all decided to do a ranking process and that I would provide a summary to you all on that ranking process so that way you can determine if there will be interviews, who will be interviewed, who will serve on the interview panel, and what the rest of the process looks like. I did not receive documents from everybody, and so I think maybe that should be discussed on how maybe we need to revisit what that process looks like and what other steps maybe we need to take. The only documents I received were from Michael Taylor.
Way to go, Michael. And Chantel, you and I had a conversation, and from my perspective, when we're looking at taking on something that is this important and potentially this expensive, looking at something on paper and after a while, they all begin to look the same to me. They all perform similar functions. And so, as I mentioned to you, my preference would be that we would schedule meetings with all 7 of the bidders. So,
I'm the same.
Okay.
I mean, I don't see a reason not to interview all 7 of them. So, I mean, I've got your evaluation tool and gone through them, and I think it's a good start, but I really want to talk to them and get a feel for who they really are besides something written on paper.
So I guess I have questions. If that's kind of the direction you all want to go, if you want to have interviews, will these be public body interviews where you all would want to serve as an interview panel? Are you wanting to appoint staff to coordinate and conduct these interviews and bring summary back to the body? What would be your preference?
my preference would be to have them face to face. If with me, if I have questions, then I would like the opportunity to ask someone. And how that works, I'm assuming if it's all of us, it's a public meeting. And it's just a forum where members of the public can also hear the responses and the questions.
The questions could also be formulated in any form, whether it be a staff conducted or the body conducted. You could generate the questions that you want to make sure you touch on. It would give a little bit of structure to your presentations. You could set time limits for your presentations so that it won't go into hours per company, but you can set a time limit for each one. I have a lot of different models that we could go for that.
May I?
If that's a direction.
Okay, so if we were to instruct you to prepare a set of questions that would be asked of all of these potential providers, there's nothing that limits us from asking follow-up questions that aren't on that list, correct?
Correct, not at all. But it's just a starting point for discussion. It gives them something to prepare, to bring to you. And we have general questions that maybe the proposals already entertain or that they answered, and they can just come and elaborate on those very same things.
Okay, that would be my preference, that Chantel and her staff, since they deal with this on a regular basis, would develop that set of questions that would be asked of all of these potential providers, and then that their answers may lead to follow-up questions from us individually. And I would think we could do this over maybe a couple days if necessary, and probably an hour at most. What is your experience there?
An hour is standard,
Okay.
especially if we have companies traveling in, to give them ample time for setup and discussion, question and answer, and then just make it worth their time.
Madam Clerk, when is the next scheduled policy and governance meeting?
There may be one in November.
Yeah, wait a second, December?
Maybe November 16th?
Well, we'll cross-check that, but if, if it's not set on the calendar, I will schedule a special, but I would assume we would target November 16th for the date for those people to arrive.
We're talking multiple dates, so correct?
It'd be your
Well,
preference.
Yeah, I
You
would
could
think.
start at 9 a.m. and go till 1 hour per 7 companies, or you can break it off into 3 and 4. I guess it really just depends on what else is scheduled for those days and what's on your calendars.
Because it would be just potentially opening a meeting on Monday and then just recessing that meeting for multiple days if we needed to. I would think trying to cram all 7, for one, cramming all 7 into one day would be difficult. 2, it would probably be difficult for us. 2, it'd be difficult for the logistics of getting all 7 of these people across the country to the same spot at the same time. So I could be wrong.
I'm hopeful that giving them 4 weeks' notice would allow them to have some representative to be available to make
Okay.
the date, a date that's set.
Now, if we're saying that week of, that would,
Yeah, so I'm just looking at the calendar, and I have a P&G meeting on the 16th. Okay, and then for me, the 17th, as of now, is wide open, so if we could do the 16th and 17th, that would be.
That they may also provide a little bit of flexibility to give a couple options. And I'll try to schedule them evenly on those 2 days, three on one and 4 on another.
okay, so we want to schedule interviews on November 16th and 17th for those 7 and have Chantel's office develop a series of questions, probably no more than
Whatever is
15?
customary.
10, 15?
Oh, I don't think I've ever asked more than 10. Usually discussion will develop, and an hour is a lot to get a lot of really good information in.
Yep.
I'd say 10 is the max, so I'm going to try to stay at below
Perfect.
that if possible.
Perfect.
All right.
Perfect.
was that a motion?
Sure.
Second.
All those in favor say aye. Aye.
Thank you, Chantel.
No problem. And
And then with
no,
item
no
3,
action on 3.
that's what I was going to ask.
Okay, back to 3. Oh, it's you, Chantel.
Yeah, no action.
I don't think, I think we were able to accomplish what we needed on item 5, so I don't think there's any action for 3.
No action on item 3. Thank you for your time.
Thank you.
Item 4, social services. Good morning.
Good morning. Did everyone receive what I sent out yesterday? And if not, I have copies, and I need to give you one. So what I sent out yesterday just provides some basic framework, a starting point for discussion on our space needs. And it's not going to end up being obviously exactly that. It just gives us a place to start. So hopefully that information is useful. I had previously provided a general geographic area that we were looking at based on poverty areas with high poverty rates and poor health outcomes. And then Keith had provided a really good map showing what is in that area and overlaying with all of how the bus lines run. So what we're working on right now is combining all of that and looking at where, excuse me, looking at where our clients traditionally come from across the county, looking at zip codes, and then overlaying that information with everything else that we've developed so far and seeing how that shakes out. So at that point, we would have the higher need areas identified, where our clients typically come from identified, what is available in those areas, and how the bus lines run among all of those things. So that is where we are currently, and that is what our next step is that we would want to be able to show you.
I think that makes a lot of sense to analyze where your clients are coming from and then utilize that to help make decisions. So thank you for doing that. Did you provide a copy of this document to the clerk? Do we need to receive it?
I have one for her that I'll hand her as soon as I get that.
Motion to receive the information, the document.
Second.
Motion is second to receive document. All those in favor say aye.
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 Thank you.
Motion to receive Christie's update.
Second.
Motion is second. All those in favor say aye.
Aye.
Aye. Item 6, discussion of possible action regarding town hall presentation by the Oklahoma State Senate redistricting staff.
Yeah, so I don't know. I believe you all have had your opportunities to go out and visit with Keith at the Senate on redistricting. When we were out there visiting with him, and when he had come by the office, one of the things that he has done is to have town halls to provide public input on the redistricting process. And what I'd like for us to do is follow that model here so that those folks who are going to be impacted the next 10 years can have an opportunity to have some input to better understand the process. And so I'd like, doesn't have to be me, it can be anybody, someone to work with Keith to schedule that date.
Okay. What are we in? I mean, what do these town halls look like? Is this something that, is this gonna be an open meeting for all 3 commissioners to be at?
We
Is
can,
this-
yeah, Miles, we can hold open meetings posted elsewhere after hours, if you will. That would probably be my envision. That way, at least someone from the 3 offices could be present, could answer questions if necessary. So
So are we looking at 3 possible town halls, one town hall? What do we, I mean, I don't care one way or the other, but
I think part of that would be Keith's availability. Obviously, a minimum of 1. Maybe at Metro Tech or some other place that's fairly easy to get to, has the ability to accommodate a crowd and the technology necessary to put maps and things up on the screen. Or we could do it here.
Well, I'm just looking
after
at
hours.
I'm looking at the calendar. My first thought would be our facility on Lincoln is centrally located, in a big room where the treasurer does his treasurer resale, or somebody does.
That's a brilliant idea.
And then, I don't think we need more than one meeting. But I would think the timing of when they go into session, I forget, do we okay something and then it goes to the legislature to pass? Is that where that gets all piled into? Or once the BOCC blesses those lines, that's it?
That's, yes. The legislature, other than assisting us in developing our plan, doesn't have any role.
Well, what I meant by that was, do they have a deadline we have to have ours turned into?
I believe the statutory deadline is November the 30th. Is that correct, Miles?
I thought they moved it. I'll go with what you. Sure. I thought they had moved it further back than that. But there's several deadlines that they've moved. So
Yeah, I know they moved some of their
the December
deadlines
31 deadline.
as it related to their own redistricting because some of the populations didn't come in as anticipated.
Yeah.
I know in special session, they're gonna take care of their business. And there's probably gonna be some adjustments made to filing dates to accommodate the new lines, if I remember
That's
correctly.
that's the way I understood it.
But I don't recall any discussion related to the requirement that we be done by November 30.
I think having it done by November 30, we should have it done by November 30. I mean, that's just my personal opinion.
I know but Michael, the idea of the Lincoln building is great. So if you guys are amenable,
So we're just going to do one town hall at the Lincoln Building?
Would that be a recommendation to the commissioners?
that's fine as
Yeah, it
well.
would be. Yeah. Is that your motion?
Oh, well,
If not, it's mine. How's that?
Second.
It's my item. Thank you. So the motion is a recommendation to the Board of County Commissioners to schedule a town hall meeting at our Lincoln building in order to have public input on our redistricting process. Is that okay?
got it. All right, motion and second to recommend to the commissioners town hall presentation. All those in favor say aye. Aye. Well, it's fairly short today. Citizens participation. Seeing none, board comments. District 1.
Baseball record has been broken, 3 grand slams in a series. I think it's just 3, right, Miles? Yeah, I know. Well, you know what? We talked about this yesterday. If my Braves are fortunate enough to get to the World Series, they won't win. So you can give it right back to me then.
No, thank you.
Any rebuttal?
No.
Okay.
We'll just keep hitting ground balls over here. Don't worry about it.
Fair enough. Any other comments for District 3? I just want to take a point of privilege. My father passed away earlier this morning.
Oh, my.
Cancer got the best of him, but he was able to see all his children, talk to some grandchildren. He was at peace at home, and he was, I guess I followed in his footsteps in some ways, United States Air Force, construction, and he was a lifetime Whirlpool / Maytag guy, so He'll be missed. Any other new business today? Seeing none, entertain a motion to adjourn.
So moved. Second.
Two motions and a second. All those in favor say aye. Aye. Thank you.